Hey guys, how are you? Once again, this is Dr. Frederick Brown coming to you from the Houston, Texas area. Today I want to talk about just a little quick blurb about hormones, specifically bioidentical hormone replacement therapy. Once again, for those of you that don't know, I am a family practice doctor by training. Went to family practice residency here in Houston from 99 to '02. Have a fellowship in sports medicine and currently am a solo practicing physician in a health and wellness oriented um, clinic. So basically, when it comes to hormone replacement therapy, it's kind of an issue that a lot of clinicians dodge. When that legislation came out over a decade ago that said, hormones are potentially bad and dangerous and so forth, it really froze a lot of us up from actively prescribing and being involved with hormone replacement therapy. Of course, most of us know, however, that was for synthetic hormones. So it's the synthetic hormones that cause the blood clots and the cancer risks and so forth. Plus, it doesn't even address one of the most prevalent hormone deficiencies that exist is testosterone. So, in terms of who can benefit from these pellets, the patients that we clinicians see every single day in our practices, those with fatigue, irritability, moodiness, sleeping disorders like insomnia, low libido, excess belly fat, insulin resistance. The list goes on and on, mental fog, and so forth. Um, Obviously, it's for menopausal and perimenopausal women, but what a lot of people don't know is that it's for those going through andropause as well. And that's in both men and women, occurring average of about 15 years prior to the onset of menopause. So once men and women reach their 30s, certainly 40s, sometimes even down as low as the 20s, you can get these hormone imbalances, which cause a tremendous breadth of symptomatology that we see in our offices every day. Unfortunately, a lot of us get sucked into treating the symptoms with medications and so forth instead of getting to the root cause, which is hormonal imbalance. So that's kind of where my experience comes in with BioTe. BioTe is a company that cumulatively has a decades, almost 3 decades worth of experience balancing hormone with the utilization of pellets, which are about the size of a grain of rice for women, goes right under the subcutaneous fat, or right under the skin into the subcutaneous fat, and balances hormones for 3 to 6 months. The reason I chose BioT is because as a family practice doc, I didn't consider myself as a hormone specialist, and really it comes down to purity, potency, and efficacy of the actual pellets, along with the proper dosing mechanism and dosing regimen that BioT provides. So it has an algorithmic dosing system individualized for each patient. It's been a pleasure to work with these guys. I came on real early in the process. It's been over 2 years now. Back in 2011 is when we started, and it's really been a blessing to my practice. It's been a blessing to my patients. It's really transformed my practice by being able to treat hormones, and people will absolutely seek you out. Able to touch lives as a practitioner in ways that never have been able to before. Most of you practitioners know that when someone comes in with fatigue, we would conventional medicine allows us to check their hemoglobin and their TSH, and we have to give them that look and say, hey, your labs are normal, and there's something wrong with the patient, can't quite put the finger on it. A lot of those times it's going to be hormones. And so BioT allows you to get those hormones balanced, transforms patients' lives, and quite frankly, that has been the most fulfilling thing to me as a practitioner, actually probably that I've ever done. For people to say, you saved my marriage, you saved the relationship, you saved my job, saved my life, those are things that we have absolutely hear, and it's fun to have such an impact on the patient. So, anytime we can get to the root cause of a whole myriad of a clinical syndrome, in this case, low T syndrome or hormonal imbalance, menopause, andropause, whatever you want to call it, you can not only fix, multiple issues in one natural solution, you can also prevent the patients of going down the road of either A, polypharmacy with something for pain, something for sleep, something for this and something for that, you can also allow patients to get a natural intervention to actually help them prevent disease. So that's just a quick blurb. You can certainly go to biotemedical.com, BIOTE medical.com. And also, of course, you can go to my website, www.drfabrown, Dr. F.A. Brown, which is me.com, and see you on the next post. God bless.